In recent years, there's been an accelerated use of digital innovations to improve the quality of perinatal care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter with AHA. Technology has become a critical aspect of healthcare delivery. Digital solutions have provided avenues for improved access to OBGYNs, doulas, lactation consultants, specialists, and more. Apps for remote patient monitoring or chat and text-based navigation services offer additional ways to support and coordinate care. Joining Priya Bathija, Vice President of AHA Strategic Initiatives, is Dr. Christina Yarrington, Assistant Professor of Obstetrics and Gynecology at Boston University School of Medicine. Dr. Yarrington shares how the use of rimidi, a remote patient monitoring system, has improved perinatal outcomes. This podcast is part of AHA's 7 in 7 series.
Thank you, Tom. Dr. Yarrington, thank you so much for speaking with me today. At Boston Medical Center, you are using Rimidi's technology and services to improve perinatal care. Can you tell us a little bit about Rimidi, how it works, how it's helping your patients as they go through their pregnancies?
Sure. So at Boston Medical Center, we're focusing our work on postpartum hypertension in our partnership with Rimidi. And the concept of pregnancy-related hypertension and preeclampsia is all over the news, but what some people don't know is that for many women, that hypertension persists even after delivery. It's one of the leading causes of readmission, hospitalization, and for some women, even death. So at BMC, we started this program of equipping our moms at risk for postpartum hypertension with one of Rimidi's cell-based blood pressure cuffs with instructions to check their blood pressure every day. We monitor a web portal with our skilled nurses from the clinic, and following an algorithm, we'll reach out to start or modify medications, or in cases of women who have symptoms or severe range blood pressures, even have them come in for evaluation. Having 2 kids, I know how crazy and busy it is in the first couple of weeks with a newborn. My focus was to keep women at home with their children without sacrificing excellent care. So I look for a product that asks for the least possible of the patient and their device rather than requiring syncing with something or filling out a web form or pushing a PDF off to the clinic or provider. Just put on a cuff, press one button, and when she sees her blood pressure, I see her blood pressure. And so I know that we can stay on the same page.
That's really cool. And I love that you took that user experience perspective when you were evaluating different solutions. I think it's so important. So, what are some of the outcomes or successes you've seen since you've implemented Rimidi?
Yeah, there's really 2 sides to that coin. One is that we're able to provide more comprehensive and complete postpartum care to the population of women at risk, but also this solution is genuinely patient-centered. Our model of care used to be that if a woman was at risk for hypertension postpartum, we would arrange for a visiting nurse, which is a wonderful service, but it's limited by the zip code where she lives and by her insurance. And 70 to 80% of our moms are insured by Medicaid, which might be limiting. If we couldn't get a visiting nurse, we would have her come all the way into the hospital for a clinic-based visit, bringing her newborn, bringing extra diapers and the whole thing. And it really just wasn't patient-centered. So we actually started arranging this program well before COVID hit and took away our visiting nurses and kind of compelled remote care. And so as a result of universal remote blood pressure monitoring, we're connecting with so many more women. We have professional recommendations for how often and the timing of blood pressure evals for women at risk like this. And now we're easily meeting that at 100%. This is in contrast to the usual model of, oh, you come all the way to me for care and then we'll make it work. That's really challenging for most, if not all, women taking care of a baby. So in the end, women are getting more care, but with fewer appointments and less disruption to their time with their newborns. Now, perhaps most importantly, as we look back on our data, first of all, we're caring for about 200 women at any given time. And early pass in our data showed that we're starting medicines in about 6% of these women, opportunities to get ahead of a hospitalization in many cases. But maybe most important, there's a qualitative part of that work, of that study, where we're interviewing patients, asking about their experience with it. And what we're hearing is people feel well cared for, they feel paid attention to, and they feel engaged in their care. And that last one is huge to me. because hypertension in pregnancy predicts hypertension later in life, and in some cases, even stroke risk later in life. So, my hope is that by empowering women with this information and activation now, maybe that further empowers their primary care journey later in life.
Yeah, that's great to hear. And there are so many longer term impacts that we don't often talk about related to postpartum hypertension.
Yeah.
It's great that you're getting them to think about that now as they take on the future. So, some patients might not have access to the same technologies, the same broadband internet. Can you tell us a little bit about how you're ensuring digital health equity for your patient population as you look at this or other solutions to sort of meet them during the perinatal period?
Yeah, this was a huge part of our decision to partner with Rimidi in particular. Our decision to partner with them at Boston Medical Center was very much based on their platform. And I said a little bit about the choice of device earlier and how I thought that was optimal for busy, especially first-time moms. But we're a safety net hospital. We serve a large urban population in Boston. Vast majority of our patients are lower income, as reflected by their Medicaid insurance. But for our patients, it's not like smartphones are a luxury. They're ubiquitous. Everyone has access to the web, access to social media, and you'd think we have our pick of platforms. However, while our patients have these tools, there is a real digital divide with respect to data and connectivity. For our patients, there's a real implication of a technology that draws on their data plan. And this is something that was particularly true as we explored various video platforms during telemedicine. But because the Rimidi product uses the local cellular network rather than Wi Fi, it decentralizes that burden of connectivity away from the patient's individual data plan or even their local
Mhm.
geography with respect to so called free Wi Fi, and instead relies on this distributed network of cell towers. And so, with this, we can ensure that the tech choice we make for our patients genuinely minimizes the potential barriers that exist from a divide of data expense and availability. We can give the device, but we also need to anticipate what barrier there's going to be to really use it. And I think this meets all those needs.
Thank you, Dr. Yarrington, for being with us today and for sharing some of the outcomes your patient population has experienced after integrating Rimidi. And to our listeners, thank you for joining in and stay tuned for upcoming podcasts in this 7 in 7 series. Thank you.